We'll continue with posterior evaluation of the elbow. Again, feeling for our bone landmarks, we're going to feel for the medial epicondyle of the humerus and the lateral epicondyle of the humerus. And we're going to place our transducer in a short axis right across those structures for evaluation of the deep olecranon fossa. Now we'll continue with the short axis evaluation, sonographic evaluation of the elbow, and with the transducer placed in a short axis across the olecranon fossa. The bone anatomy that we're going to see over on the upper left-hand side of the screen is going to be the posterior aspect of the medial epicondyle. And as we move the transducer a little bit more to the lateral side, you'll see the posterior aspect of the lateral condyle of the humerus. Now, between the two condyles, you're going to see a deep horseshoe-shaped structure, which is actually going to be the olecranon fossa with a fat pad sitting in between. Now, superficial to the fat pad, you're going to see the muscle of the triceps and then part of the triceps tendon in short axis. If I move the transducer down towards the olecranon, you'll see that I'll get a kind of a wave-like pattern with articular cartilage sitting on top of it, and this can be confused for the olecranon fossa. The olecranon fossa is more proximal, deeper, and horseshoe-shaped. Turning the transducer so the orientation marker is pointed towards the patient's head, I'm going to move the transducer down on top of the olecranon, and sitting just superficial to the olecranon, you'll see the fibrillar pattern, a part of the triceps tendon. And as you follow the triceps tendon down deep, you're going to see part of the muscle fibers, and then deep to that will be the long axis view of the olecranon fossa. So you want to make sure in this evaluation, we're going to be looking at the triceps tendon structure. So we're going to move the transducer all the way medial till we lose the complete component of the triceps tendon. Slowly sliding the transducer from medial to lateral. The triceps tendon you'll be able to see, muscle deep, and moving all the way out onto the lateral aspect of the elbow. The last aspect that we're going to take a look at or visualize on the posterior aspect of the arm is going to be the potential space for the olecranon bursa. Now, the bone structure that we're going to see is the hyperechoic echogenic line of the olecranon, and superficial to that is going to be the potential area for the olecranon bursa. Now, it's very difficult to actually see the bursa when you have full compression on the skin. So the technique that I'm employing here is I put a thick gel pad between the transducer surface and the skin layer, and therefore I can actually see the skin line all the way down to the olecranon itself. So I know that I'm covering the potential area for the olecranon bursa in its long axis. Rotating the transducer counterclockwise, I'm going to do the same thing as I'm going to see the skin surface, the olecranon bursa area, and then the olecranon process in short axis.